Hi, and welcome everybody to this presentation from the Cybersecurity Insider program. Thank you so much for taking time out of your day to join us. Today we're going to be talking about the new healthcare and public health cybersecurity goals, the HPH cybersecurity goals. So hopefully you'll find this of benefit. My name is John Gomez. I'm the Chief Security and Engineering Officer here at CloudWave. I hope that I've had a chance to meet some of you, and if not, look forward to meeting some of you in the future. Hopefully at one of the upcoming events such as HIMSS or potentially the Muse user group or one of the other areas that we may cross paths. With that, I want to get into this. I want to give you a little background on us, and the reason I want to do this is because I think it'll ultimately come back to the HPH goals and some of the things I'm going to share with you. I don't know how much you all know about the cybersecurity team here at CloudWave, so I'll give you a little bit of background. Long and short of it, we used to be a company called Sensato. We were started in 2013, and we were acquired by CloudWave in 2022. We specifically focus on healthcare cybersecurity. It's all we do. We have a memorandum of understanding with the FDA related to medical device security. We're the only cybersecurity firm across any industry sector that has that. We also are an ISAO, an information sharing and analysis organization, working with DHS and CISA and some others. So our legacy has and continues to be 99% focused on healthcare and critical infrastructure. We also do work with city governments and some other ancillary organizations. As you would expect from pretty much any cybersecurity firm at this day, we have a variety of advisory services, which include things like tabletops and pen testing and security risk assessments and HIPAA assessments. And the reason I'm bringing all this up is, and some of the other things I'm about to bring up, is because I think this feeds into the HPH goals and some of the things we've been working with clients for a very long time. And so we're actually pretty excited to see the HPH goals, because for people that we have been working with, this should be a real simple thing to achieve. But even if you don't have all of these things in place, I'll try and give you some suggestions on things you can do. First and foremost, we have a two-part thesis, and this thesis is kind of composed of this first part here, which is comply, detect, respond. And simply stated, what this means is we believe each and every day that we get up, it is our responsibility to work with our clients and things like the FDA and others to simply help organizations comply with best practices, detect threats, and respond to them in a timely, professional manner. And we think if we can continue doing that day in and day out, then we are hopefully developing the best posture for our clients from a cybersecurity perspective. Now, we also understand and believe that this is just half of the equation. In fact, I would argue that probably most cybersecurity firms should be doing this, and this is just foundational. It's the ticket to the dance. The second part of this that we think is unique to us and that we also focus on is how do we help our clients reduce legal liability and improve their legal defensibility? Specifically, if you have a breach or you come under a regulatory audit or somebody files a civil suit or a class action lawsuit against you, how do you defend yourself if that is focused on your cybersecurity program? And so one of the things we try to do is really focus on what strategies, procedures, policies, and protocols can be put in place to help an organization ultimately, hopefully, reduce that legal liability and increase their legal defensibility. Now, the reason I bring up this two-part thesis is because a lot of what we talk about in the HPH actually speaks to a lot of this. And I think we have to think about what does the HPH goals that we're going to talk about, how does that impact our legal liability? What position does it put us into as a healthcare organization to actually think about, well, now that there are these published goals, what if I don't meet them? What if I don't embrace them? What if I don't take them on? Is that going to impact my legal defensibility and liability ultimately? And so that's part of what we're going to be speaking about today. For those of you that don't know, and if you haven't seen our presentation on our Cybersecurity as a Service program, a quick ad that I'll tell you is our CAS offering pretty much helps organizations meet all of the requirements in the HPH goals. So I think it's just something for you to know, and if you're interested to learn more about that, please let us know. Anyway, enough of the background. So for those of you that don't know, on January 24, 2024, this past January, ASPR, which is the Administration for Strategic Preparedness and Response. It's part of the US government, and they work on readiness and preparedness for different sectors. They obviously work very closely with HHS. And what they did is they announced that HHS is releasing, as you can read on the screen, a new voluntary set of performance goals to enhance cybersecurity across the healthcare sector and other gateways such as physician practices and allied sectors for cybersecurity resources. Now, I think it's important before we dive into what are the goals and some of the background is what is in this headline. And there's a couple of things that stand out to me. And again, we're trying to look at this from the perspective of not just comply, detect, and respond, but also how do we help assure that we position the organization, your organization, to be defensible in terms of a legal situation. So when we look at this headline, one is it's voluntary, right? You don't have to, go and embrace these goals, these cybersecurity goals that have been put in place by HPH. And I'm going to come back to that concept of voluntary in a few moments, in a few slides, but it is for now a voluntary thing, right? So you don't have to do it. On the other hand, the next word is performance. And I think that this is an important thing to keep in mind, that if these are being characterized as performance goals, if you end up getting sued, and we'll talk a lot more about this, there could be legal implications to how you are viewed in a lawsuit. So I'll come back to that and help kind of clear that up a little bit, but I wanted to highlight first and foremost that these things are voluntary, yet they're considered performance goals, and so that may cloud a little bit about how voluntary these things are. I think the big thing to take away is, at this point in time, the government is not ordering you to do this, right? But that doesn't mean that it's not a very significant nudge to go do this. So there is some background. How did we get to these HPH goals? Like, how were these formulated? So there is a report that was put together. It's known as the Hospital Cyber Resiliency Initiative Landscape Analysis. And this report, which is about 55 pages long, is the culmination of a variety of work that was done through different groups that came together to try to quantify what are the biggest threats and challenges to healthcare cybersecurity. So if you haven't read this, it's kind of sort of a good read. It's not a bad thing to go out and check out. But ultimately, what is important to know is this report is the foundation for all of the HPH goals. So they kind of went through and examined, I think it was 380 hospitals or so, kind of looked at how they're doing cybersecurity. These hospitals were different sizes, and they then figured out, hey, based on what we're seeing across this population of hospitals, these are the things that really everybody should be doing at a minimum, and here's what they should be doing at a more of an intermediate and advanced level. And so we'll get to those in a moment, but one thing I do want to call out in the introduction of this report is this kind of development here, where the FBI and DOJ are now treating the patient and public safety risk that cyber attacks are posing on hospitals as threat to life crimes. Now, I want to pause for a moment and just talk a little bit about that statement in this report. And again, I want you to think about this from a liability perspective. The fact that DOJ and FBI have started to say, hey, we're going to look at attacks against hospitals as potentially threat to life crimes is great, right? It means that the concept of a hospital being hit or a healthcare entity being hit is being taken much more seriously. The problem with that on the other side of the coin is that it now means that you need to take cybersecurity much more seriously. Because the moment that FBI and DOJ or any organization in the government is starting to classify that a cyber attack is a threat to life, we need to understand that defending against a cyber attack for a healthcare organization means that your patient safety should be a priority, right? Because you have to defend patients against threats to their life, right? You can't allow them to deteriorate. You need to maintain a quality level of patient care. Now, if you've been part of any of the conversations we've had on incident response or if you work with us on our CAS program, or you've been through our tabletops, or any of the things I've mentioned that we do, we have talked about patient safety as the first priority of all cybersecurity programs. The challenge is that there's really no good template that you can follow that helps you develop a patient safety first in cybersecurity incident response program that we know of, other than the stuff that we've built. And we're going to be doing a seminar, and we'll talk more about it at the end of this presentation in next month's Cybersecurity Insider program that talks just about that. But I want to highlight that this report and the HPH and everything we're starting to hear coming out of HHS is really focusing on this kind of battle cry around patient safety has to be the first and foremost consideration around cybersecurity defense. And the other thing to keep in mind here is for forever, right, since we all got into this, the focus on most of our cybersecurity programs has been on patient data privacy, protect the data. And we're now suddenly seeing a shift to protect the patient. And again, we'll talk more about this in next month's CIP, but that does change a lot about how we defend and respond to a cyber attack. So I wanted to kind of at least set the preamble for that, but also set up the fact that this report has a lot in it that you may need to be aware of in regards to how you structure your cybersecurity strategy and your go-forward plans. So I took out some things out of the report, and I'm not going to go too deep into this, but this is regards to an attack that occurred in 2020. This was quoted in the report, and I think this is a good kind of starting point for you to understand when we talk about incident response, what you need to be prepared for. And what this is a organization that was hit, a university hospital system in the Northeast. Pretty sure I know who it is, but I'm not going to out them. But what they shared is that 1,300 servers and 5,000 endpoints were infected. And this, just so you know, happened in a matter of moments. And that resulted in their systems being out for about 40 days overall. So again, this is changing the landscape of how we do incident response and, more importantly, recovery. So I just wanted to kind of give you that. And yes, you guys can have these slides when we're done. So if you want to use this information within your own organization to help them understand what you're trying to do and the challenges you have, hopefully the slide deck will help you position that. The next thing that came out of that report that I think is important is, what are the critical best practices? So when we look at that patient population that is in the report and we figure out who is doing really the best job at protecting the organization, we can see that there are a variety of things here that are critical to success in defending your organization. So you can kind of sort of almost use this as a somewhat of a checklist, but I think the way to think and the way to maybe think about it is, are you doing these things? And if you're not, probably start thinking about, this is now kind of considered the basics, right? And when we think about legal defensibility and liability, these are the things we're going to be measured on. So hopefully this is helpful to you. It gives you an idea of what are the leading security tools or technologies or priorities that are being used. These are not obviously the HPH goals, but they help form and drive the goals that we're going to be talking about from HPH. I found two other things that were kind of interesting that I wanted to put in here. I'm not really sure how realistic this data is, because I can tell you most of the organizations we deal with and work with, even very large university systems, don't have this level of staffing. And this is a double-edged sword now, right? Because now that the report is saying, hey, on average, the median is about 38 full-time employees that are focused on cybersecurity. What now that does for you, for the, depending on the size of your org, is it puts you in a defensive position, right? Because if you get into a legal battle, whoever's suing you is going to say, well, you should have had more cybersecurity people. Here's a report from HHS, and that report says that here are the averages for different hospital sizes. And now you have to defend why you do have or don't have that amount of resourcing. So I don't really know what the answer is to this, because I think this is not really a good thing that's in the report, but it's there and you should be aware of it. On the other hand, maybe you can use this to help justify getting more staffing, which obviously is always good for everybody, because you're probably overworked and probably underpaid. So hopefully this helps you kind of illustrate to leadership, if you need to, like, hey, we're probably, for most of the organizations, at least that I know of and interact with, we're understaffed. And I think we all know that, but we're now seeing it in black and white come out in the report. Again, I don't think that these staffing levels are are typical, but now they're considered, in writing. So you have to think about how you would defend against this. This next slide, I'm going to give you a preamble to. I don't like this at all, but I get asked this question a lot. So I pulled it out of the report because, especially when I talk to board of directors or CEOs or CFOs, and even when we do HIPAA risk assessments, people will ask us, well, what are other hospitals like us spending? Or can you compare us to other hospitals and how they're doing? And so here you go, right? You can kind of take this and show whoever you want what you're doing versus other hospitals. What's the average spend? Now, there are a couple data points here that I thought was interesting. And what it is basically, if you're a smaller organization, you're probably paying or spending more on cybersecurity than a larger organization, right? So smaller hospitals, if you look at what's on the screen, invested higher in cybersecurity at 0.76% of their budget now, or of revenue. Now, what's interesting to me about that is if you read further down, it's not because they're taking cybersecurity more seriously or over investing. It's because they can't get the same economies of scale that a larger organization with greater buying power can. And I think there's a few ways that we as CloudWave can help with that. And we'd be really excited to talk to people about this. And right now, this is a kind of a foundational idea. But one way is to bring together, smaller hospitals and put you into kind of a pod, right? And say, hey, look, we have 10 hospitals that are smaller, and we're going to formulate a pod around you where all of you now have collective buying power. Now, some of you may be parts of GPOs and things like that, but we're thinking about doing this a little differently. So if you think that some form of a collective group of smaller hospitals can increase their cybersecurity buying power across all purchases, let us know, because that's something we would be excited to help foster and champion. And the other thing I'll call out is we have always as Sensato, been very aggressive in terms of how we price for each area of the sector, right, for each size of the hospital. So I know for hospitals that are working with us on our CAS solution, we price you at a lower price point simply because you're smaller. So I thought this was interesting, just to help kind of give you some insights into some of the data that was found. Now, what I'm going to tell you is, do not use this ever for planning purposes. And I'll explain why at the end of this presentation. If you want to use this just to go, that's kind of interesting or whatever, but don't ever use this to budget. And I'll explain why in a moment. But again, I thought it was kind of an interesting to call out. So all of those things together, all of that data, and there's a lot more in that report, kind of generated these HPH cybersecurity performance goals. And this here is the actual website. On the bottom right of the screen, there's a URL that you can check out when you want and actually go interact and learn more about this. But I'm going to try to break this down to you real easy, and I'm going to give you the quick tour of how this works. So simply stated, there are basically two types of goals. There are essential goals, and these are basically considered kind of your foundational things you should be doing, right? That if you're doing nothing else, you need to do these goals. And we'll talk about each of the goals in a moment. And then there are enhanced goals, right? Which is kind of a nice term for these are the more intermediate advanced things. Now, we're going to talk more about liability in a moment. But if you need a plan and you need to think about, like, how am I going to get all this done, then yeah, a good option would be to kind of get all the essential goals deployed as quickly as you can, and then go focus on the enhanced goals. I think one thing that would not be a good strategy is if you said, well, we're just going to do the essentials and we're not going to do the enhanced. Now, obviously, if you don't have the economic capability to do the enhanced and all you can do is the essentials, then that makes sense, and you should document that and be able to demonstrate and prove that you didn't have the ability economically to actually deploy the enhanced. Now, that proving it isn't just, well, the hospital couldn't afford it. You need to make sure that you're able to demonstrate that, hey, there are no grants either at the state or federal level that you could have taken advantage of. Or maybe if you could do half of the enhanced goals, but you can't afford the other half. So you really need to be cognizant of how you're stating that you can't afford to do these things. And again, I think this is why thinking about some different strategies, whether you join a GPO, whether you come back to us at CloudWave and go, hey, yeah, we think it'd be interesting to create a collective and figure out if there's reduce expense because it's getting more and more costly. I think those kind of things you need to start thinking about, because ultimately, you know, when we go very back to the beginning of this and we talked about that, hey, cyber crimes are now being dealt as a threat to life, you know, it amps up the responsibility in terms of how you're defending the organization, both technically and legally. So, you know, I would look at the essentials as a phase 1 and the enhanced as a phase 2. I would not look at the enhanced, regardless of what any documentation may say, as optional. I think if you look at it as optional, you're not putting yourself in a very good defensible position from a legal standpoint. And I guess one thing I should have added to this entire presentation, I'm not an attorney, and CloudWave is not a law firm. So anything we tell you in this presentation, please speak to your general counsel and help them kind of come up to speed on this topic and guide you in terms of what you should do ultimately, how to defend and prepare your organization to be defended in case something were to happen. So basically, those are the 2 types of goals. Now, when you go into that website that the link was for, you'll see that you can collapse and expand each of the goals. And when you expand them, one thing these guys did awesome is they actually crosswalk things to the different types of practices. They also crosswalk them to all the NIST controls, and they also crosswalk them to the CISA CPG IDs, right? And so I think that was really great because you now have a set of goals that are completely crosswalked to NIST at the very least. And one of the things you'll see in that report, if you ever read it, is that NIST now plays a very strong piece of getting to a point where you're considered secure, right? So all of these goals crosswalk to NIST. The underlying kind of theme here is you should be embracing NIST-CSF and eventually try to get to NIST 853. Although 853 for many hospitals may be beyond their economic capability. So at the very least, try to get to NIST-CSF. And I think what's important there, if we kind of dip deeper into the pool, is that, you know, HIPAA is not as prevalent in terms of what we should be doing. That doesn't mean you should not be HIPAA compliant. You have to be HIPAA compliant. But to say I'm just HIPAA compliant or we did a HIPAA assessment and that's all we did, again, you're not putting yourself in a very strong defensible position. Again, go back to what I said about DOJ and FBI thinking about, you know, cyber attacks are a threat to life. HIPAA has nothing to do with protecting life. So if you said, hey, we're HIPAA compliant, and the next question is, well, what's HIPAA got to do with protecting patient safety? The answer is, well, nothing, but we are HIPAA compliant. You're not going to be in a very good defensible position. You have to think about, like, okay, we got to get to NIST-CSF at the very least. And if you're doing NIST-CSF, you're automatically meeting HIPAA, so you should be fine there. All right, so when we take a look at the essential goals, these here are the essential goals. This is what they're asking you to do at the phase 1, for example, right, is mitigate any known vulnerabilities. Now, this should be a process and a procedure, that you have a process and a procedure and the tools to mitigate known vulnerabilities quickly, that you have email security in place, that you're using MFA across the entire organization and all of your assets, not just some of them and not just for certain things. Basic cybersecurity education is being done. This goes beyond just your annual HIPAA refresher, right? This is cybersecurity education, anti-phishing, proper use of MFA and credentials, proper credential usage and management. You know, this is your end user education. You're using strong encryption and you're storing the keys correctly. You're doing credential management correctly. You're doing basic incident response. You have unique credentials across all accounts. You have separate user accounts and privileged accounts. You're not using your admin or privileged accounts to log in and do your work every day. You don't have local domain all over the place, domain admin, and you have vendor and supplier cybersecurity requirements in place. You've defined things beyond BAA to support your vendor and supplier cybersecurity requirements. Now, what I did here is I gave you a table that you could easily convert to a spreadsheet. So the reason I have maturity here, I'll explain in a moment. This is what is your plan to address this? And hopefully you have some costs, and then you can track your status. Obviously, you could do this any way you like or would work for you. But I think it is important that, over the next 30, 60, 90 days, you get a sense for how much of this you're doing. And I'll talk about maturity in a moment, so you have a sense of how do you score maturity if you do a kind of self-assessment. The one thing I will give you a warning on is this is still very subject to interpretation, right? So how you think about mitigating known vulnerabilities and how I would think about it may be very different. And so you do need to get a sense of, how is this being interpreted? How is the goal? How are you meeting the goal? Like, what is that requirement? And HPH does give you some guidance on that at that website I gave you. Now, the enhanced goals, or this phase 2, as I would call them, are these things. You should have a pretty complete and thorough asset inventory, including assets related to your medical devices. You should have a third-party vulnerability disclosure as part of your partner agreements. Again, we're trying to get beyond HIPAA. We're trying to go past the BAAs. We have requirements for third-party incident reporting. How do we report incidents to third parties and how they report them to us? We are doing cybersecurity testing. So this includes pen testing, but even beyond that, we're doing application security testing. We have the ability to do cybersecurity mitigation when we find a risk, or if we're doing testing and things come up, we have a plan and a process for mitigation. We detect and respond to threats. I bolded that because we've been kind of doing comply, detect, and respond now since 2013 when we started Sensado. So, this is all kind of in our wheelhouse, but you have that ability to detect and respond to threats. So this is where things like SIMs and network intrusion detection and honeypots all come into play. This next one, network segmentation, is probably the bane of everybody's existence, right? We've been pushing hard for people to get network segmentation in place. A lot of healthcare organizations still run flat networks. This is kind of pushing you down that path that you should get network segmentation in place. You should try to centralize log collection. You need to have centralized IR and preparedness, and you need to have some form of configuration management, which includes things like your baselines and the ability to do patch management and some other things there. Now, again, similar kind of layout here. If you start doing your enhanced goals, what is the maturity? What is the plan? What are the costs involved? And what is your status? What I'm trying to do is give you a couple tables here that you can use to quickly kind of highlight to your management, hey, here's where we are, here's what it's going to cost, and here's our plan to get there. So very crude, obviously, but hopefully it gets you started thinking about how do you put a process around the HPH performance goals. So let's talk a little bit about maturity, right? So when we look at maturity, we look at it at 4 different layers. And so you can use the same thing for your own kind of review of the HPH performance goals. One is not implemented, right? We're just, this is where you just say, well, we're not doing that. We're going to have to go invest. We're going to have to put a plan in place, and we need to start doing that over the next X amount of months or year. Partially implemented is kind of where you're saying we do that, but maybe it's not, very well managed. It's not fully supported. It's not fully rolled out, but we kind of have it there. Maybe it's not fully documented, but people kind of sort of know that we do this, right? We kind of sort of have an incident response plan. Everybody knows what to do, but it's not fully documented. Or we don't have written playbooks or protocols. We have asset inventory, but it doesn't include our medical devices, or, we don't really run it more than once a year. Or when we do cybersecurity testing and disaster recovery testing, we don't really look at our backups. Like, we know that we're backing things up. We kind of sort of know that we're okay if we have to restore, but we don't really look at the integrity of backups very often. So that's all partially implemented. Largely implemented would be a step up, right? Things are well understood. They are pretty well documented, but ultimately there's room for improvement. The way I describe fully implemented when we're talking about maturity is if I gave you all the money in the world, you would be able to say to me that, hey, there's nothing I could do. I've done this as best I can, and even if you throw more money at it, it's not going to get any better. That would be considered fully implemented. So basically for each one of these and these, you kind of want to go through and decide, like, this is partially implemented, largely implemented, fully, not implemented, whatever you guys have. And then you'll have a plan. You'll have a starting point that you can do. So that should be hopefully a pretty simple way to kind of get an assessment on your own, a self-assessment as to where you stand with the HPH performance goals. Now, I want to talk about like where I think these things are going. And these are my personal views, but I will tell you they're based on some conversations I've had with people that were working on the HPH performance goals and some of the things they've already talked about. but they're not yet ready to come quote unquote public with it. Now, this may all turn out to be not something that happens, so that's why I'm couching this in, this is a personal thing. But I think it'd be easier if you just assume this is going to happen, and if it doesn't happen, you'll still be in a better position. The first thing that we've kind of thought about is that as the HPH goals evolve, if there is not a strong uptake of them, if hospitals don't voluntarily start using these and demonstrating that they have these things in place, then we do think that CMS will gauge reimbursement on these goals. That you will be in a position where if you don't have these things deployed, then CMS reimbursement may be reduced. The same thing with JCO audits. We assume, and I spelled JCO wrong there, I apologize for that, that JCO audits will, at some level, when they come in, start asking for proof of evidence or proof of practice related to these goals, especially because, if you remember all the way back in the beginning when I said, hey, this report is calling out that cybersecurity attacks are a threat to life. And JCO is very, very concerned about patient safety, right, as is CMS. So we can see these being natural evolutions where we've crossed the chasm from, oh, that's just the techie stuff, we're not going to worry about it, to now, hey, this has an impact to patient care, quality of care, and patient safety. So that's kind of what I think is my view of where this will end up. Obviously, if there's a massive uptake and hospitals are embracing this, then there probably won't be a need to do this, but I think there would be a carrot and a stick kind of approach if we don't see that voluntary adoption. So let's talk about the legal landscape, right? Because this is the other side of this. So let's say there's no CMS JCO, kind of fallout, right? That nothing comes from that. But now we have like, oh, we've had a breach and you're getting sued and it's 18 months later, or the Office of Civil Rights comes after you and takes a look at what happened in your hospital, or some other regulatory body decides to do a review of what happened for your attack. Well, we've changed the landscape, right? So whether it's a set of attorneys coming after you from a civil suit or class action suit, or it's government regulators, we're now looking at this from the first question that should be asked is, and I guess let me phrase this in a way that hopefully gives you a little bit further insight into why I'm saying about what I'm about to say. If an attorney or a law firm would come to me and say, hey, John, we want you to be an advisor to us because we're going to sue this hospital because they had a breach and we need an expert witness, what do you think we should do? So what I'm going to tell you right now is what I would tell that law firm. First thing I would tell them is, hey, we have a qualitative foundation, and those are the HPH performance goals. So let's first ask that hospital, let's subpoena evidence of practice for each one of those goals. So that's the first thing that I would recommend. Let's figure out what that hospital's doing around these HPH performance goals, right? And we already know that these are out there, they're publicly accessible, they're supporting evidence. The Health and Human Services is saying this is what people should do. These are the performance goals, right? Yes, they're voluntary, but it's pretty much a strong qualitative foundation that hospitals should be doing if they're trying to protect patient safety, right? Which is the second point. Let's really focus on how well this hospital embraced the IT mission now, the IT security mission, to protect patient safety, because they now know that cyber attacks are an attack on life. So let's start asking that hospital, what did you do? Are your incident response plans prioritizing patient safety or patient data? Is your cybersecurity architecture and defenses prioritizing patient data or patient safety, right? These are the things we're going to start looking at. Does informed consent take into account cybersecurity risk as part of your disclosure to patients, right? There's a lot here that is brought about because of this, right? We now have a report that talks about minimal staffing levels, right? And so, does this hospital actually have the staff that they should have had to run an effective program to protect patient safety, right? So this all starts to come together in a case that we start to put together against this organization. Now, let's talk about the spend, because earlier I showed you, and I said, like, a lot of people always ask me, like, well, how are we doing compared to other hospitals, or what are other hospitals spending versus our size hospital? And I will always tell people, you should never, ever base your cybersecurity program on what another hospital is spending. And so I want to highlight to you what would happen if you did this. So first step is you're going to get deposed, right? And maybe not you guys on this call, but your CEO or your CFO or your CEO, COO, or somebody, probably, somebody in that area. And you guys may get the pose, but you're probably not going to get the questions I'm about to ask you. And the first question I'm going to ask one of those C-suite people is, so tell me, how did you come up with your cybersecurity budget? And let's just say, keep it simple, that they say, well, we looked at the HCIR report, and in there it had kind of a representative sample of what hospitals were spending as a percentage of revenue on cybersecurity defense. And we thought that would be a good way to understand if we have, we should spend about the same. Right? So that seems like a logical answer, right? Because hospitals have been doing this for years. Like, hey, we should be spending the same as these other hospitals are. That's why you ask for the comparison. If you do that, you're going to have a really hard time over the next few minutes. Because the first question I would have the attorneys ask you is, so tell me, in that report, did it describe the actual hospitals that were being surveyed? Did it give you the names of them? The answer to that is no. Okay, so how do you know what security systems they invested in? Do you know the actual products they invested in? Do they have the same EMR as you? Do they have the same network architecture as you? Do they have the same security talent? Do they have the same level of IT staff that you have? Do they have the same hiring and onboarding practices as you? The answer to all that's going to be no, no, no. So yet, despite all of that you didn't know, you thought it would be a good idea to go spend the same amount of money on the current threat landscape, not knowing if that would be an effective enough solution to protect patient safety. So do not ever put yourself in a position to say, well, if hospital B is spending it, we should spend the same as them. If you want to kind of do well, at least as much as them, maybe that's a way to justify it. But that's not a good defense. Your defense should be, we're spending what we need to spend to protect our environment and our patients against the current threat landscape with the tools that we've deployed and the people that we have, right? That's what you need to demonstrate. That's typically going to be your defense. The other thing here is standards adoption, right? I mentioned that a lot of this is tied to NIST. So again, you should expect that a question is going to be, are you using NIST-CSF? And the answer hopefully should be yes, we are, right? Because we now know these are kind of the ticket to the dance. This is the low bar, right? We're not just doing HIPAA. So again, this is my perspective. Just a reminder, I'm not an attorney, but I'm trying to frame out for you that, hey, the HPH performance goals may be voluntary in terms of HHS, and they're not mandated at this point, but they also created an amazingly awesome body of work for attorneys that can bring class action and civil suits against you. So I would highly suggest that you talk through this with your teams, right? Your organization, and say, hey, we need to think about, are we going to go down this path and eventually get ourselves on the HPH, essential and enhanced goals. So that's that. I will tell you there is, for those of you that have used our HIPAA assessment, which is a what we call C2M2, which is based on the Department of Energy's maturity model. And so if you've seen this before, this is kind of the dashboard, the output of going through an assessment with us. The good news here is that we look at 10 different domains. And for all of you that have gone through C2M2 with us, you automatically have done an HPH performance goals assessment, because we've been doing that since 2014. And so you probably already know where you are and you already understand the challenges. For those of you that haven't done this approach, highly recommend that you talk to us about it. It is a very different approach to HIPAA. It is patient safety focused. There's a ton of outcomes and documentation you get, roadmaps and board briefings and all kinds of stuff. So point is, you can certainly self-assess as you go forward and you start thinking about, hey, this is kind of a next level in terms of how we have to do compliance and risk assessments. I hope that you'll think of us and talk to us about what we may be able to do to help you with that. And ultimately, if you're using or not using our CAS program, again, you probably can check the box on a lot of the HPH performance goals, especially around 24/7 monitoring and asset management and a bunch of other stuff. So again, if you don't know what that is or you want to talk about it, would love to talk to you about it. So I don't know if we have any questions, Laura, or not, but that's kind of everything I was hoping to get to you guys and give you some food for thought and kind of help you start digesting some of this, especially what are the kind of not so obvious ramifications of all this. So Laura, any questions or anything?
We don't have any questions at this time.
All right, so I'll hand it back over to you. I know you want to give people kind of a second insight into what we're doing in March.
Great, thank you. Yeah, just wanted to give you a reminder that the March Insider webinar will be focused on incident response and focusing on patient safety. So be sure to join that. That's March 28th at 2 p.m. and you will get reminders about that webinar. And then also I wanted to draw your attention to, I put a link in the chat. If you are going to HIMSS, we would love to have you come by our booth, say hello. We'd love to meet you face-to-face in person. And if you're able to stop by, we have some Starbucks gift cards for you. So please come say hi. And then we are also hosting a customer appreciation reception on Tuesday, March 12th at 4 o'clock in our booth. If you are attending HIMSS and want to join us there, there's a link in the chat that you can RSVP for that. And I'll put this information in the follow-up email as well. So that's all that I have.
All right, so I think with that, we truly appreciate your guys' time. If you'd like a copy of the slides, Laura can get those to you. Obviously, you have access to the recording. If there's anything we can do for you, clarify something, if you guys learned something along the way, please let us know so we can both learn together. But with that, hope you guys have a great rest of your week, great weekend, and I look forward to next time we get to chat. Thank you.
Thanks, everyone. Have a great day.